while you're getting set, let me introduce Justin. So Justin, how long have we known each other now? It's been a bit.
3 years, maybe.
Okay, so for about 3 years, Justin and I have known each other. We had a mutual friend of ours, you know, essentially say, hey man, my friend mentioned he follows your work. Is it cool if you hook up with him in LA? He's going to be there. So me and him hooked up together and hit it off sort of right away. He's a complete nerd, just like me. What I call sort of a jock nerd. Justin's really interesting because he's got this sort of interesting, he's an artist. He plays music. He has an art-based mind. He also has a very science-based mind. And of course, he's a meathead, kind of like me. So of course, we hit it off sort of right away. Now, I want to set you up for Justin because Justin is one of these people that when you first get introduced to his work, you're like, wow, this dude really knows his stuff. And you might be like, it's over my head a little bit. Because he goes very deep into some stuff that not a whole lot of people are talking about. However, it's some of the more important work that I feel like I'm learning from now. So I spent a lot of time listening to Justin talk about this idea between how we think and behave and how that impacts our immune system and rolls over into behavior, and how these things aren't different. All this crazy that we're doing is sometimes causing crazy in our bodies. And so he's going to talk about a little bit about this idea about disordered eating, a little bit of the autoimmune connection, and a little bit more. So for those of you who are not biochemists and endocrinologists and all that kind of stuff, just don't get nervous and be like, oh my God, just sit and listen to and pay attention to the connection now. This is a lot of new stuff that not a lot of people are talking about. He also wrote a book that I want to plug because all my friends are super humble, so they're not necessarily going to plug their book, but it's this book here, The Flexible Dieting Disaster, Why Counting Macros is Destroying Your Relationship with Food and Yourself. And so those of you who aren't clinicians and a lot of this stuff is going over your head, this is what's beautiful. He's got a book that you can go and get that gives you the in-depth stuff. So definitely go and get this book and for your clients as well. So Justin, thank you for being here, man. Appreciate it.
Yeah, absolutely. By the way, I have copies for all of you here if you want them. So, yeah.
You live streamers, send him a message and get mad at him.
Yeah, I know.
Here, so this just, let's see, you're on, and I think you're ready, so it's just down from there. May the force be with you.
Cool?
Cool.
All right. All right, y'all, you ready?
Yeah.
So, yeah, to kind of echo what he said, like there's a lot of craziness in this, and it's kind of sciencey and it's, you know, over the top a little bit, but my intention with this is really just to have awareness for you all about how you can look at this and see the connections again, but because we need to see this, because you might have cases with clients and women who are just, you know, completely, complicated and you don't know why, right? And so that is the intention with this. However, I will give you a sort of general feel of how to address autoimmunity from, a natural standpoint, an alternative standpoint, when conventional medicine can't really offer more than medications, right? So, but bear in mind, like there are specific diseases that require individual approaches and different specific things to that disease. So it's hard to do all that in an hour, right? So that's why we're kind of going with this angle. So what I want to do here with this objective is to bring awareness towards, again, these overlooked threats to female metabolism. So that's trauma, right? It's ASIA, which is autoimmune syndrome induced by adjuvants. So we're going to talk about vaccines, actually, silicone breast implants, Botox, things like that, which are highly controversial these days. Eating disorders, disordered eating, and then, of course, autoimmunity. All right, so this is a long list of different autoimmune diseases, and as you can tell, there's a lot. In fact, there's probably about 100, 80 to 100. And you don't need to memorize this stuff or know it all, but just so you're aware of like how many different types of diseases there are. And there's probably more we don't even know. It's that confusing still. So if you think about it, the incidence of autoimmune disease has really changed. And over the past 60 years, 70 years, probably even, it's skyrocketed. And this is just a handful of different diseases, Crohn's and MS and type 1 and asthma and atopic disorders and Hashimoto's especially. So we need to be aware of this because why is that happening, right? And in fact, I would say this kind of parallels with disordered eating. They're both going high. And that's a problem because they actually connect to each other. And I'll come back to that in a little bit. So this is an issue. And why is that? Is it really the genetics? Or is it lifestyle? Or is it environment? right? Rhetorical question, I think. But so here are the stats that we can look at. The NIH says there's about 23.5 million people with autoimmunity, and then the American Autoimmune-Related Diseases Association estimates probably double that, which is pretty staggering, actually, because you think about cancer, 12 million, 13 million for cardiovascular disease. Both of them together match the incidence of autoimmunity. But we don't really think of it as a major health crisis or a threat if we get a diagnosis of it. A lot of us don't, right? But it can progress to these sort of major health problems like cancer. So Hashimoto's is one of the ones that is becoming more and more and more common, right? Especially in the female population. So 14 million Americans have it, but women are 7 times more likely than men to get it. So it's, autoimmunity as a whole is a female-dominant disease. 75% of diseases of autoimmunity are related to females. All right, and there's reasons for that too. And by the way, so come back to what Jay talked about with hypothyroidism, and a lot of women will have those symptoms. You may need to rule out Hashimoto's and check for antibodies, and that's why it's so critical to do that. And a lot of doctors won't do it because of insurance and the cost of that. And so there are ways around it where you can do it on your own, have your clients do it. But it's important to check into this because 90% of these people, these women who have hypothyroidism actually have Hashimoto's, oftentimes. All right, so, and these are the ratios, as you can see. So Hashimoto's 10 to 1, and lupus, and then Sjogren's. And it kind of varies, but you get an idea of like, well, okay, Hashimoto's is really up there along with rheumatoid arthritis and autoimmune hepatitis. So it is, yeah, a female discriminatory disease. And we can see that, again, 80 to 95% of women have Sjogren's and lupus, right? And thyroid disease. And that's what we see with these diagnoses, is that it's not men that have these, it's mostly women. And so that's the numbers up top are in the millions. So, 2 million with Sjogren's, right? And lupus is 300,000. So, and then obviously thyroid dysfunction and Hashimoto's and Graves are 4.4 million. So it's a lot, okay? So why is it one-sided? All right, so there are 4 major reasons as to why this is. And so women carry 2 X chromosomes, as you might know. But the thing is that 10 to 15%, one is, active, and the other one has about functionality of 10 to 15%. If you have genetic SNPs, which are some of these, you don't need to really know what they are. It's not incredibly important right now, but if you have these and they're expressed, well, that can cause overexpression of the certain parts of the immune system that are responsible for autoimmune disease, right? So if you think about it, so Klinefelter syndrome is a rare disorder along with Turner's, and so if you have a male, right, who ends up with Klinefelter syndrome, right, and they carry this problem, they have 2 X's, so then they're going to start to suddenly develop, enlarged breasts and have reduced size in testes, and so they actually develop the same risk for developing autoimmunity as a woman. And vice versa for Turner's, if females have that, they have a reduced risk of autoimmunity. Interesting, right? So that's also part of the reason why women or men don't get autoimmunity as commonly as women, is because of the lack of testosterone. Testosterone is actually really beneficial in suppressing the B cells, which make antibodies. And then, of course, the microbiome is highly variable between genders, and so Faecalibacterium prusnitzii is one that we see, and that's really a lot lower than it is compared to men. And then estrogen, of course. So Jay talked about how tissues and everywhere throughout the body there are estrogen receptors. And so the immune system has these receptors too. So if you have a lot of estrogen floating around and xenoestrogens in your body, they're going to activate the immune system. And if you have something like an antigen or a trigger, a bacteria or a virus or whatever that is, and that gets activated and estrogen is floating in the body, well, you're just putting kindle wood into the fire, right? So that is the situation there. All right, so one thing I'll say with postnatal autoimmunity, so I don't know, how many of you have had women who have said to you that all of a sudden I develop these crazy symptoms, I have fatigue and gut issues and cold hands and feet, like typical hypothyroid issues, right? All of a sudden after they deliver. Well, a lot of times it's Hashimoto's. And the reason why is they already have the genetic susceptibility, but during pregnancy, this is just important to know because during pregnancy, everything shuts down. You actually get in remission, right, for a period of time. And then all of a sudden, you get out of pregnancy and you deliver. Within at least 6 weeks to maybe a couple months, antibodies start to skyrocket. So, point is, if you see these symptoms show up with women, you really want to check this out and get antibodies tested, TPO, anti-TPO, and anti-TG for the thyroid. All right. There was actually one more thing I wanted to say about that. I didn't write it. But anyway, so the other thing I'll say is that this is actually really heartbreaking, but a lot of women I've spoken to in my career, they've told me that they have kids with autism, right? And they have autoimmune disease or Hashimoto's. Is it really a coincidence? No. Because we find that women who have hypothyroidism and are not on thyroid meds or have antibodies in their blood and not actually tackling their disease and trying to get it in remission, they have their child has a 4-fold increased risk of developing autism, right? And we wonder why autism is so common these days. And so that's why it's really important for your clients and women as a whole to take care of themselves first, because it's really doing a disservice to their offspring, right? All right, so Jade and I might differ a little bit on this, but my little bias is against birth control a little bit because of its impact on women who have autoimmunity. So again, like I said before, we know that estrogens can have an effect on different parts of the immune system. So T cells and Th1, you don't need to know all that really, but the point is that if they're activated, right, estrogens are usually fueling that. And so synthetic estrogens and progestins are a source of that. And so actually, I'll tell you what, I actually had a DM last night on Instagram that from a woman who has MS, and she's like, I was doing really good, changed my lifestyle, did some things, took Plan B, and then I felt like I got run over by a train, right? If you think about it, that's like a shit ton of levonorgestrel, so you have a lot of that, and that's exactly what's happening, right? So it's a double-edged sword. Like, we know we need it sometimes, but it is definitely like the Achilles heel for women if they're still on it and have an autoimmune disease. I really try to help them get off of it, but again, it's not your job to tell them to do things. Like, you really want to educate them and have them be aware of this, because it is pretty dire sometimes. So, right. So there are a lot of slides here, and I'm not going to really go into the research much, but other than to show you what it is, and you have these slides, and you can read it at your own time. But yeah, it's just showing my point here about how hormonal birth control increases the risk from multiple diseases, psoriasis and lupus and RA and MS. So it is a problem for, again, women who have the genetic susceptibility. That's really what it comes down to. So it comes back to that question I asked before about, is it really a genetic thing or a lifestyle thing or environmental thing, nature versus nurture? So we know the concordance rate, or the susceptibility to developing an autoimmune disease in monozygotic twins, is only around 20 to 30%. So two twins have the same genes, but one of them gets type 1 diabetes and the other one doesn't. Why is that? So you can see that it's quite a wide range, but it's really not more than 25, 30%. And that's really what the consensus has been, I think, in the functional medicine world, is that 30% of autoimmune diseases is related to genetics, which means you really have a lot of control over this, which is actually really empowering, right? If you were destined to have an autoimmune disease the rest of your life because of your genes, that would suck, right? Yeah. So I didn't make that up, but that's the phrase that really stuck with me a long time ago. Genetics hold the gun, the environment pulls the trigger. You could all have the right genes for it. I could too. My mom has Hashimoto's. I didn't say that initially, but that's why I do this work, because my mom went through this entire process, and I could have the genes. I don't know. Didn't get tested for it, but if I keep my health in check and all that stuff, then I won't have a disease. So it really doesn't matter, actually, that you have the bad genes for Crohn's or MS or Hashimoto's, for example, as I look at it. So these are the 3 stages of autoimmunity. So you have this prodromal period, which is like when you have signs of antibodies in the blood, which we'll talk about in a minute, and when symptoms start to manifest, okay? That's stage 1. I mean, we'll talk about that in a minute, but Most people get diagnosed in stage 3 when they have high antibodies, significant symptoms, and there's tissue damage and loss of function. That's a problem, okay? Because these antibodies show up in the blood multiple years before then. And this is a great sort of illustration here that shows this, because you can see, even I can't see here. So lupus, for example, antibodies will show up in the blood, right, 7 to 10 years prior to diagnosis, typically speaking, when doctors diagnose them in stage 3. And that's a problem with conventional medicine that, in general, because they won't diagnose you until you've had significant symptoms and like evidence of damage if they do a biopsy or something like that. So you really, again, if you have women, clients who have, one of the best questions you could ask is, anybody in your family have an autoimmune disease? Because then you can screen them and run these antibodies and be like, hey, let's just check this out and see if they're in the blood. Because if they have no symptoms and they have antibodies, great. You have an amazing ability to help them right now and stop it in its tracks. But if it starts to progress, it gets much, much harder. And I know this from experience where we've had women who have just been recently diagnosed, right? And we can literally put in remission in 2 or 3 months. They're as good as new, right? And they have mild symptoms, but we've had tough cases of women who've had it for 15, 20 years, and they have lupus and Hashimoto's and Crohn's, and I've had tough cases, and even Dr. Eva has helped me with some of mine because it's just so challenging. Once you're so far down this road, it's really hard to get out. Not impossible, it's just much harder. So you really want to try to look into this and help encourage them to take action now, right? It's like you pay now or pay more later, literally. Okay? So again, these are just showing the antibodies that you can test for, screen for Addison's and Crohn's, and you can see that. The positive predictive value is pretty high, so it's a pretty good marker. So yeah, this is just showing again that when women get diagnosed with lupus, for example, you can see antibodies showing up 6 years prior. So anti-DNA, double-stranded DNA, anti-Ro, these are some of the anti-nuclear antibodies. These are some of the biomarkers that we test for lupus. Okay, so this is my autoimmune funnel model of what I use and how I think about addressing somebody with autoimmunity. It's a lot of, what a lot of research have kind of denoted is that it's a leaky gut, genetic susceptibility, and some sort of stimulus or environmental trigger. I've kind of split it out a little bit more because it's easier to digest, I think, to assimilate. But we ignore the mental, emotional, adverse trauma part, and that's a flaw, in conventional medicine and even in the naturopathic world. We don't really, a lot of people don't address that stuff. So this is like kind of a diagram that shows really what can happen when you have the right genes, you have epigenetic changes, so that can go on too, which in a sense just means that the environment is signaling the genome in a certain way to behave differently, right? So you have the genes, you have the environmental triggers, the diet, the infections, the toxins, and so forth. And then you have the sex hormones, right? The estrogen, like we talked about, and neuroendocrine factors, so stress and all that plays a role in here. And it converges into this immune response where it either has immune tolerance or loss of tolerance. So this is a little, little complicated. I'm not going to go into this. But basically, if we're talking about the genetic issues that makes up this 30%, it really resides within this, the major histocompatibility complex, which is really a set of genes and chromosome 6 that codes for proteins that lie on the surface membrane of your T cells and immune cells. And so there are different classes, but a lot of what we find is that there are SNPs and not mutations, but polymorphisms or genetic variations of the class 2. So it's just so you're aware of this. It's not all just that, but that is a lot of what we've seen in the research. So what that really means is, so if you have an antigen presenting cell, so that's like, this is how it all begins. You have a dendritic cell or some immune cell that is going to grab onto, say, Epstein-Barr virus, right? It's going to digest it, place it on its HLA sort of protein that we talked about that those genes code for. So if you think about celiac, right? There's HLA DQ2, DQ8. We can test that, see if you have that. And so when you display this and you put that virus on that HLA, then it signals the T cells. And we find that there's some sort of misrecognition and some sort of like dysfunction with that, not only here, but also at the receptor. So it's more than just this, but you can get an idea of how there's some sort of issues with the immune system and these receptors as what's causing this. So there's a lot of confusion here. So these are some of the genetics variations that we have identified. It's not all of them, but it gives you an idea of what we've associated with Graves and spondyloarthropathies and ankylosing spondylitis and psoriatic arthritis and so forth. So yeah, HLA-DRB1 is a notorious one that we see a lot. So let's talk about environmental triggers. And this is not a comprehensive list, but it gives you a good idea of a lot of the common things that we see and are issues for not everybody, but you really want to start asking questions to your clients of like, well, what's your job? Like, do you work in a nuclear power plant? Do you work in a dentist's office? Are you exposed to a lot of mercury, right? So what are their exposures? Have they traveled often? Were they in Thailand? And I've heard that a lot. Or we swimming in the murky sea and you got a parasite, right? We need to be aware of that stuff. And so these things can cause autoimmunity in different ways and different diseases, of course, but we need to know that this is a lot of stuff that we're exposed to in our, in home with our personal care products and even, outdoors as well, right? Nail polish, right? Who would have thought that? Again, it's not to freak out, and I'm not trying to get people to, have anxiety and stress over that. It's not helpful at all. It's just awareness that maybe some of these things can be a trigger. So BPA, Jay talked about that earlier. It's a major xenoestrogen and a major endocrine disruptor. And we know that not only does it do that, right? Not only is it worsening the estrogen load, but it looks a lot like thyroid tissue, right? So there's this molecular mimicry thing going on, which we'll talk about briefly, but if you consume a lot of plastic, and it's actually one of the first things I always tell clients to do is like, stop drinking your coffee with a lid on it. Because guess what? The heat and the acidity of that is leaking BPA from the lid. Right? Thermal receipt paper, right? You don't need to always take your receipt. And so drinking out of plastics, of course, all that stuff matters, especially with women who have Hashimoto's, because the immune system will see that and they'll start to attack it potentially, and then they'll attack your thyroid because it looks the same. So that's that molecular mimicry thing, which we'll come to in a minute. But and you can see how in research we see that mercury amalgam fillings, right, which actually contain some BPA. If they're removed, we see antibodies drop in some people. So again, I'm going to rip through these studies, but we can see that glyphosate, Roundup Ready, that stuff can be an issue for some people. You may have heard about that Monsanto, kind of lawsuit that went around in non-Hodgkin's lymphoma, right? So it is something to consider and think about, especially if your clients are, playing out in the grass and using a lot of that spray and stuff. But it's also in GMO foods. So you also want to help them modulate that diet as well if they have rheumatoid arthritis. Okay, so again, just random kind of insights here. So we see that, again, there are many different triggers that can initiate lupus, for example, right? UV light, alcohol, cigarette smoke. All right, so this is probably going to be of big interest to you, and that's autoimmune syndrome induced by adjuvants. All right, so these are substances that we don't necessarily think about, but they are in vaccines, right? They're the adjuvants in vaccines. They are silicone breast implants, okay? Botox, these sort of things that we know can induce autoimmunity in genetically susceptible people. Not everybody, okay? So this is really important because we get people get really uptight and really emotional about vaccines, right? Anti-vaxxers are pretty much like, no, it's the worst thing ever, which really is not the case. We need them, but they can be an issue. Same with implants, right? So this is some of them that we've found in the research, and so again, it's stuff like aluminum that's in vaccines that is an example of what is an issue for people with autoimmunity, because that's, if they take a vaccine, if they do the HPV vaccine, they may suddenly develop worsening symptoms. And we don't really know because look at that latency period. There's a delay of 2 days to almost 23 years. So that's why the research is so hard to kind of pin this down and see like, why Are vaccines really responsible for autoimmunity? Are they responsible for autism? It's hard to know, right? But again, it's something to be aware of because we can see that these adjuvants can do that. And that's just showing us that, yeah, what's happening is this entire immune response, molecular mimicry, epitope spreading by standard activation, which I'll talk about in a minute. So, so HPV vaccine, for example, right? We can see that it's been associated with antiphospholipid antibodies, anti-ovarian, anti-TPO, and thyroid, right? We talked about yesterday how some women may have premature ovarian failure. Well, 20 to 30% of women who have it have an autoimmune disease. This is maybe one reason. So again, just another study highlighting that post-vaccination can induce things like Sjogren's, which, if you don't know what that is, it's an autoimmune disease to the lacrimal glands that make your tears and your saliva as well. Yep, and that's the study there on HPV and premature ovarian failure. So yeah, we find that this is one of these hidden things that not a lot of people are considering and thinking about. All right, so this is the take home with vaccines and autoimmunity. There's not a lot of evidence on this, right, to show like a cause and effect type thing, but we can see that there's a strong association, okay? And again, it comes back to this genetic susceptibility and the HLA polymorphisms I mentioned earlier, all right? So that's what we want to be aware of. It's not to say that your clients can't do vaccines. I'm not saying you should discourage them from doing it or yourself, but it's, you got to think about the entire picture and like, well, if you have this family history of autoimmunity or you're on the spectrum, maybe you should take this into consideration, and maybe pass on the vaccine. But again, you make your own informed decision. Botox, well, where does that come from? Clostridium, right? So Clostridium is one of these infections that I've seen plenty of times be a problem with Hashimoto's and Lupus. And so it is, yeah, it's been shown to induce antibodies. So again, I had a client actually who had breast implants, and she had Hashimoto's and Lupus. And when we decided to, for me, it's not like, okay, you have implants, we need to get them out immediately. It's sort of like, okay, let's chill and do everything else first. And then if things don't improve, let's consider it. Granted, this was about 1.5 years ago, but we did it. We got them removed, and well, she did rather, and suddenly she felt better, right? It's not a surprise. Yeah, so the thing with this, and this is a hot thing in the fitness space right now, is everyone's talking about, silicone breast implants is the worst thing ever. It's unfortunately their bias from their perspective, which I respect, and we should, acknowledge that, but not everybody is impacted. I have a really good friend who just got them in, and she feels great, okay? It's all about individuality. We have to really understand that. But we should also trust our instinct and our intuition, because a lot of women feel better when they get them removed. And we can see that from the data, like 66%, 65% feel better in all these joint pain and muscle pain and allergies and fatigue and all that stuff when they get explantations. And this is just a case study showing that, that there was a diagnosis of Hashimoto's like 10 to 15 years after these implants were put in place. So it can vary, and it's not like you get them in and you're going to develop antibodies and have an autoimmune disease right up like the next day. But it's something that we should be aware of, because if they have, again, the genetic issues, then maybe this is contraindicated. Again, more research showing antibodies and implants. All right, so moving on here. Yep. All right. We're going to talk about infections and microbes, because this is really, really important. It's really, really common. Okay, so if you have somebody who has a lot of issues, unexplained issues and symptoms, and you don't know why, right, then you really want to check for infections. So before I get into that, why are infections such an issue these days, right? Everyone's got Candida and SIBO, it seems, and it's like, all these herpes viruses. But we know that a lot of it has to do with the environment, and really a couple things, right? If we were born through, say, C-section, we don't have that bacteria that comes through the vaginal canal that impacts our immunity, okay? If we're not playing in the dirt as kids, right? Not to say you should be like living in the dirt, but if you're not exposed to that, it's gonna affect our immune system. We can see that in the data. And so it's no surprise that children who are born or growing up in rural communities have less incidence of atopic disorders, asthma, allergies, eczema, and so forth. Plus, the highly sanitary conditions these days and antibiotic use, which I can't tell you how many times I've seen that, where you also want to ask that question, have you been on antibiotics as a kid? Because that will literally, it's like putting a nuclear bomb in your gut. And so a lot of people don't recover from that very well, especially if they have not been taking probiotics and doing that 4-hour gut restoration stuff we talked about, or Jay talked about before. So it's really important to understand that. So this is, again, I want to highlight the fact that the sex hormones really impact the immune system in people with autoimmunity. So it's not very clear, but we can see that there's a kind of a bidirectional thing going on, so that we can see that the sex hormones, like the estrogen in a woman, can impact the microbiome. That can maybe cause dysbiosis, and then that can therefore cause leaky gut, endotoxins, that sort of things, which can then trigger the immune system. And also the other way around, where estrogen can, the bacteria can then sort of cause leaky gut, and then they communicate with the immune system, and that's also what can trigger this entire phenomenon. And so with testosterone, there's a sort of suppressive effect, which is, again, why men don't have it as common. All right, I'm not going to really go through this, but you have it, so you're aware of, this isn't everything, but I've dug into the research a lot, and I've seen a lot of this show up with clients, actually, but we should be aware of this because, think about Selma Blair right now, who's got MS. If you're aware of her story, she's talking about it. And who knows if she's actually considering these things. A lot of people aren't even, considering these infections. We know Lyme disease, I'll come back to that in a minute, is one of these things that can trigger MS and mimic it. So it's all saying that there are a lot of infections that can induce autoimmune problems. All right. Psoriasis, H. pylori. I have a client that had psoriasis, and I tested for H. pylori. She had it. We got rid of it. Psoriasis gone. So it's really like that. That's how important this is, because we could be avoiding all this, the use of these immunosuppressants, which are really, really damaging to the body over chronic periods of time. Not so you can't use them, but imagine if we could avoid that stuff if we really look for these triggers. Epstein-Barr is a real common one, which, by the way, you really want to ask that question of, did you have mono as a kid? Because if you do, then you have the virus. It doesn't go away. But it can be reactivated, and that's where it can cause issues. So this is really interesting stuff. Rheumatoid arthritis is one of these diseases that we can see there's a correlation. Actually, it's causative data with P. gingivalis, which causes gingivitis. And this can literally cause rheumatoid arthritis. It's not the only thing, but it's one of these things that it's not talked about a lot. So what happens here is if you have P. gingivalis, it makes an enzyme called peptidyl arginine deaminase, I think. And so what it's doing is it is changing arginine in certain tissue to citrulline. Okay? So if you know what the antibodies are for testing for rheumatoid arthritis, it's anti-CCP, anti-cyclic citrullinylated peptide, and then usually rheumatoid factor. But anti-CCP is such a critical one because it's strongly correlated with RA. And so what happens is that this bacteria makes this enzyme, it changes the amino acid in certain tissue, which is your collagen, your fibrin, your elastin, your vimentin. And where is that stuff? In your small hands, your joint, your elbows, your ankles, right? So oral hygiene is so critical because if you have cavitations or root canals and they're not properly handled or cleaned, you can definitely have, and there's more than just that bacteria, that species that can do this, but, right, Prevotella, Tenorella. So just understanding your client's history with, any sort of issues like that with fillings and cavitations and any sort of oral surgery is really important because, in fact, my mom actually, the other week told me she had gone to the dentist and she had an issue she had to work out. And so all of a sudden she got really sick. And so now we're in this process of looking to see if she had any sort of infections from that, because it's unfortunate because a lot of dentists won't do a thorough job, maybe, necessarily cleaning out the cavitations and root canals and doing a good job. And you can unfortunately run into this problem. So, okay. So besides those bacteria, we also have Borrelia, which is what causes Lyme disease, right? So to make a long story short here, really what we see is that there's this OSPA protein that it has on its membrane, and so antibodies that attack that will again also attack your small joints. So there's this cross-reactivity thing going on here, and we can see that from the data there's antibodies. I mean, it's not a large subject in the study, but they are there, right? And again, there's the Borrelia, this bacteria really has a strong affinity for your collagen, so it likes to hang out there, which makes sense. So just so you're aware, again, UTIs are really common, I think, but a lot of it is related to stealth infections, which means that you can run a test, but you're not going to find it. Although in the study they did, right? So what's happening is, just so you're aware of the mechanism here, what's happening is that you have a Proteus, which is one of these bacteria, and it looks a lot like your hyaline cartilage. So antibodies are made against these enzymes, and so it does that, and then it's like, hey, your collagen, or your vimentin, your elastin looks a lot like this, so we're going to attack that too, and that's another reason for RA and how that can happen. So how do you address this if you can't test for it? That's, again, a different challenge, but you can also do a lot of, maybe it's beyond the scope of this, you can do a lot of natural things to help deal with these infections that kind of address a lot of them at the same time, which is actually quite helpful. Okay, so it's just, again, showing other studies that indicate that bacteria can cause ankylosing spondylitis, which is just not a disease to the spine. Klebsiella in this case, but all this relates back to that first chart of the different infections that are known in these specific diseases. So Jade yesterday talked about lipopolysaccharides and endotoxins, which are these things that gram-negative bacteria secrete when they die, or just byproducts, and they can cause leaky gut, but they can actually get into circulation. And so if that happens, well, we can see that there's an entire immune cascade that goes on here, and you develop antibodies, and then that can attack your spine. So this is an example in ankylosing spondylitis. So rheumatic fever is just, it's a quite rare one, but again, so you're aware that streptococcal A is a bacteria that can do this. And if antibodies attack that, they can then attack your heart valves, your brain, your joints. That's what that disease is. So MS is really interesting, again, because of the fact that there are many things that can initiate this, like Lyme. But Epstein-Barr virus is one that can easily be a trigger. And I've had clients who have MS, and we test, and we find that they have Epstein-Barr. And it's reactivated, which is really, again, really the issue. Not the fact that you have it, it's the fact that you've had a lot of stress maybe, and it decided to come out of hibernation. It's in its lytic stage. So Epstein-Barr, again, can hang out in these B cells and make your antibodies. They can really just skew the entire functionality of it. And we can see, again, in studies that there is this demyelination going on. It's pretty crazy. So again, Borrelia bacteria and Lyme disease does the same thing. It cross-reacts with your brain tissue. So yeah, so if you have clients who have like symptoms of MS, right, and you just want to ask, like, were you ever are you aware of Lyme disease in your at all? Have you had a bullseye rash, which doesn't really happen a lot, but you can ask. Do you hike a lot? These are really important questions to ask, because if you have Borrelia, and I can tell you right now, I've had 4 clients who were told that they were negative for Lyme disease, and they had it. Because there's a lot of misinterpretation with labs with this stuff. I'm not going to get into that because it's really confusing, but that's a huge blunder with conventional medicine, I think, and we're not looking at it, and so a lot of people get misdiagnosed, or undiagnosed rather. So that's what that can do. Lupus, again, it's one of these things that the bacteria can really set it on fire, and so the dysbiosis is, again, the issue here. Okay, so parvovirus, H. pylori, Epstein-Barr, and retroviruses are some of the ones we've seen that can trigger lupus. So Hashimoto's, I'm not going to go crazy with Hashimoto's, but it is a prominent one to talk about because, again, it's so common, right? And so we can see that this bacteria Yersinia is one that does this same thing where, well, it can do, we don't know everything about it, but we do know that it looks a lot like your thyroid. So it actually shows TSH receptors. So if antibodies see that, like, hey, that looks a lot like your thyroid, so we're going to attack that too. I'll talk about the testing for this stuff and how you can see if your clients have it at the end, but just so you're aware. Again, just an example here, Guillain-Barre Syndrome is when you have antibodies against the ganglioside in your peripheral nerves, and so that causes basically like muscle weakness. It's like MS, but for your entire body, so you really have loss of function in all of your limbs and stuff. So it's pretty rare actually, but we can see that an infection is what can induce that. I believe it's Campylobacter jejuni, which is a crazy, interesting one, but oh yeah, it's up there. Okay, talked about H. pylori and psoriasis, that connection. You may have a lot of clients who have skin issues, eczema, which is autoimmune related a bit. And so you wanna, check for gut stuff, infections, which I find is really, really common. And so those are the two, I would say the biggest salient points with skin disorders that you wanna look into. But H. pylori is actually really common. So Coxsackie virus, again, type 1 diabetes and that connection. So food antigens. Okay, so, well, our environment has changed and so has the food in the agriculture, right? So we know that food can do this. And so the thing with food is that all we can do is, well, until we heal the gut and a lot of other things, maybe we can temporarily remove these foods, but a lot of times we kind of have to cut them out for life sometimes. Unless, of course, we are willing to pay the price for eating gluten on a weekend, which, it happens. And my clients, I literally tell them, if you want to, indulge and go and do that, but you understand what's going to happen, right? So you got to be able to impart that if you have clients who have autoimmune issues. And, we know that gluten and dairy are the most immunogenic, and for different reasons, but like dairy, for example, the casein looks a lot like your cerebellum in your brain. So that's how that can cause immune attacks against dairy, and then therefore your brain, it can cause Hashimoto's and brain fog and all these, why do I have brain fog? There's a lot of reasons, but maybe it's dairy because there's some autoimmune phenomenon going on. And gluten, of course, will do the same. That's why celiac is an issue, but it's also an issue, like literally across the board with autoimmune diseases, and I will literally have most, in fact, all of them get off gluten as best as they can, because of its ability to really cause this cross-reactivity. But again, there's a high variability between people and clients, so you really want to, again, it's not like, okay, we're going to start doing a massive elimination diet. This really irritates me with a lot of people, I think, because they'll do AIP diet, which is literally all you're eating is vegetables and meat and some fruit. It's highly restrictive and it's not sustainable, but you don't really need to go that far with diet and make those drastic changes. You can do one thing at a time. That's what you really want to do, is kind of meet them where they are, see what they're willing to do, but cut out gluten or dairy, give it a month, see how they feel, reassess, take something else out. Maybe it's nightshades next, right? Maybe it's all grains as a whole. There's testing for that you can do, but again, we don't need to make things complicated. You can do this and do this sort of trial and error thing. But it's important to do one thing at a time, I think. So leaky gut is the one thing that is pretty much related to all of these diseases. All right, so we have organisms and bacteria and things in the gut that can cause it. And so we have a lot of different barriers and mechanisms and cells that help create this brick wall that we want to have. But what happens is that if things become dysfunctional and there's a breach in the barrier, then it activates the Peyer's patch and the entire immune system, which is, a lot of it is in your gut. If you didn't know that already, it's like 70–80% of your immune system is in your gut. And that's where it resides, right past the gut epithelial lining. If that happens, then that's where things can kind of go haywire. And this just shows that stress can do that. Okay, we talk about, well, why do I have all these gut issues, right? We need to cut out these foods. Well, we gotta also look at what sort of stressors are they exposed to in their current life? Is it like domestic stuff? Is it work stuff? Is it related to traumas that maybe they're having a low-grade stress, right? So we'll come to that in a minute, but it just shows that stress and cortisol can really wreak havoc on your gut lining. And that's where it can allow for things to pass through bacteria and also those endotoxins that we spoke about before. And that just shows that we find that leaky gut is connected to literally all these diseases, and even depression and chronic fatigue. And so that's also important to know. So these are my crazy sort of whiteboard illustrations that I just want to put up there. You don't need to understand this, but it just shows how kind of complex this is. So when a pathogen comes through or a food and it interacts with this dendritic cell, this green thing here, it literally sets off this immune cascade that can push you into different directions. And that's just showing you like the sort of different varying levels of the T cells and your antibodies and what's kind of happening. Okay? A lot of people, so you have this T regulatory cell, which is literally putting the brakes on your immune system. And that's a usually dysfunctional issue in autoimmunity, because honestly, if there was an issue here, as long as that's working, and we'll talk about what you can do to increase that, you want to do that. Vitamin D does that really well. Certain bovine immunoglobulins does that really well. Curcumin does that well. So there are things you can do and supplement with that can help increase that Treg, which you want to do. Okay, Bacillospores actually is really good. Microbiome Labs makes a really good one, Megaspore Biotic, if you know what that is, and that's a supplement I'll use a lot. So I want to show you, just so you're again aware, and maybe you can impart this to your clients if you want to, but just so you're aware of some of the mechanisms, not all of them, that kind of underlie autoimmunity. So we talked about the molecular mimicry thing. So you have a macrophage, a white blood cell. It's presenting its HLA sort of protein on its membrane, which is denoted here as MHC2, okay? And it's presenting the bacteria so that it sucks up in some bacteria, H. pylori or whatever. And so that will then get presented on its membrane, activate a T cell, activates a B cell, you make antibodies. That's essentially what's happening, and that's a cross-reactivity that happens too. And so again, another thing that will happen also maybe is you have more damage that occurs from these cytokines that create a lot of inflammation, and that causes tissue damage. And so you end up making more antigens that get presented to these immune cells. So it becomes one nasty cycle. And we can see that you create these super antigens and more things that get involved. And it's like, okay, well, this is my own tissue, right? All because it's trying to deal with this one thing, right? This toxin, this virus, etc. So it's pretty wild. But the point is that, this stuff is ultimately what's occurring. So neoantigens are things like toxins, heavy metals that really can disrupt this entire immune system as well. And it essentially does the same thing.
Yeah, you have 10 minutes, so about 10 minutes to go, but keep going and I'll let you know.
Yeah, I'm going really quick as best I can. Again, just so you can see what's happening in Hashimoto's, for example. So you have an environmental trigger that gets presented to an antigen-presenting cell, okay? And it's just showing you, again, what's happening. It's activating these T cells, activating the B cells, and then it's releasing antibodies and attacking your thyroid, okay? MS, same sort of thing. You can see what's happening. Molecular mimicry, epitope spreading, all these sort of mechanisms, all because of what it decides to interact with that sets off this chain reaction. And then Crohn's, same sort of thing, but again, the gut is really huge here. So if you have something that comes through the gut lining that's really not good, it activates everything beneath that and causes the release of all these cytokines that damages the gut lining. All right, so this is really what I like to talk about the most because it's so overlooked. And again, this is important not only for autoimmunity, but for clients of yours who have weight gain and an inability to lose weight and all these symptoms that you don't know why they're still there, right? This is like the hidden factor here. So secondary immunology is really just showing us that, we have stress and that impacts everything, right? It impacts the immune system, the hormones, everything, okay? So our thoughts and our emotions, all that stuff impact that as well. Okay, so I want to show you real quick here what happens. So it's really interesting because different types of stress have different sort of effects on the immune system. We can see that in short-term stress, it's really a good thing, okay? But we can see that in chronic stress, things go awry, and this is where things get really bad, right? You've a downregulation of a lot of important immune cells, natural killer cells, which are important for fighting cancer, the Treg cells. And so if you have trauma and things like that, you end up really reinforcing this, because that's stuff that kind of goes on and on and on, and we don't really pay attention to that, okay? And of course, modern day stress and what's going on in our daily life. So this is just talking about the fact that this might be theoretical, but the point here is that our emotions, our thoughts, they impact everything. Our immune cells, our cells as a whole, okay? So, if you have clients who are dealing with resentment and shame and guilt and anger, we have to heal that and try to help them heal that. And that's difficult to talk about because it's more in depth, but the point is that stuff can literally derail your health, and we don't really pay attention to that. We think it's all just physiological stuff in the biology, but really it's more than that. Sometimes. So adverse childhood experiences, again, I'm just going to rip through these studies that show that, but the point here is that the body doesn't forget what the mind does. That's essentially what happens. So you bury these traumas in your subconscious mind, and that is what dictates your behaviors. You're an autopilot, right, with how you kind of behave. And that can be pretty detrimental to your health if it's involving self-sabotage. So the body bears the burden, right? That's essentially what this is saying. So if you have like an emotionally charged situation where there's maybe you were sexually abused and you suddenly have memories of that by seeing somebody, smelling something, hearing something, that can induce a really heightened, I'll talk about it in a minute, heightened stress response that kind of mimics that past experience. And that is what is really causing a lot of issues. So early life trauma, right, creates a sort of biological embedding, which again, really just means that there is a heightened sensitivity of the HPA axis. Cortisol is dysregulated. It changes how the physiology moves forward. Okay, so it really hardwires that stress response during the sensitive periods of development, usually between 1 to 7 years of age. Okay. The issue is that for a lot of people who go through this, they don't have the right buffering resources. They don't have a really good social network. They don't have good parenting or a caregiver to help them regulate this stuff and really just change the story around it. One thing we really need to understand is that trauma is not the issue. We all have it. It's our story and our interpretation of it. Okay, so if we can change that story, then as an adult or even as a kid, we can prevent a lot of this stuff. But basically what happens is that if you have trauma, you can have an enhanced stress sensitivity when you then are exposed to just something like a chemical, BPA or gluten, right? Because you have a heightened stress response. Why is this thing not working? And this, again, just shows, again, what I said before about how there's this change in the immune system, which is not really good, not only for autoimmunity, but for depression, honestly, because we can see the same thing happen in depression. And I'll show you some of the studies here on that. So again, just showing the connection between trauma and autoimmunity. Yeah, it's pretty crazy. We can find in studies that even 20 years later after a traumatic event, we can see CRP levels really, really high. And so it's correlational stuff, I understand that, but it is really intriguing because there's inflammation that may be going on just from something that seemed not a big deal when I was 4 years old, right? The CDC Kaiser study, the ACE study, is probably the most talked about study that really highlights these findings of how ACEs and trauma, depending on how many you're exposed to, again, it's looking at populations and seeing these connections of how, well, there's a 4-fold increased risk for, 2.5 increased risk for cancer, hepatitis, Alzheimer's, and so forth. So it just, again, it shows that there's a connection to these modern common diseases and issues that we have. And so we really want to pay attention to people's history and their biography. All right. Yep, so traumas and depression, right? Depression and anxiety, it's a real common thing in the fitness industry. Everyone's kind of got it. And it's well, why is that? Do we ever think about this? Are we all still wounded children in the fitness industry, right? So depression is, again, one of the things here we can see with trauma. Sexual abuse, again, really causes a lot of issues, and I see a lot of clients who have it. So that is one of the things I'm always looking to try to heal those wounds and pains, because we've usually ignored it, right? Avoidance and denial is what we do. And this is an entire meta-analysis looking at a lot of studies showing this. So it's correlated with not just autoimmune stuff, but eating disorders, PTSD, suicide. Okay? Yep. Trauma and autoimmunity. So this is a model taken from my book. And so what I'm trying to do is with this book, one of my goals with it was to show the connection between trauma and dieting and eating disorders and disordered eating and how that can maybe cause autoimmunity and PCOS and all these reproductive issues. Not to say that you're going to get that, but it's got to be chronic and over a long period of time. So this is all self-sabotage sort of behaviors that a lot of women do, and I've seen this for a long time. Well, why are we really dieting? Why do we have an ED, right? Were you told like you're fat and ugly when you're 5 years old, right? And if that happens over and over, and you create the story and belief, and you think, okay, in order to get attention and approval and acknowledgement, I need to lose weight. I need to do a competition, right? It's triggering for some people, and not a lot of women like to hear that, but that's something we need to uncover and think about. And this is probably the most important model in that book as well. And so it just shows that there are many things that can really influence dieting, competition, and disordered eating and eating disorders, and social media influences can obviously impact it as well. And it can kind of take you down these different paths. Not to say that you're going to do this stuff, but we should look into this and see, well, if they had trauma, okay, is that maybe why they have a fixation on macros? So therefore, should we really put them on macros, right? Or should we try to integrate intuitive eating or mindful eating? Okay? And again, this is the health outcomes that can really happen if this goes on and we don't try to change this. So some of my sort of mantras are food equality equals mental equanimity. Food discrimination is a big problem, I think, still. It's like, don't eat this food, it's going to kill you, you're going to gain a lot of weight, and that's a problem. We can't do that black and white stuff. My whole thing is like, yeah, the stress you're having about the food is a bigger problem than the food itself. Granted, if you have an autoimmune disease, it's probably a little bit different. They both matter. But for the person who doesn't have any issues, you're freaking out about eating that cheesecake. Do you think that's going to cause leaky gut over time if you freak out every time, and then the food becomes a problem because of leaky gut, right? So again, we really got to change our psychology and our belief and our view on food, and that's what this is about. And again, this is just showing, there's not a lot of data on this. I talk about this in my book as well, but some of the preliminary studies show that, yeah, an eating disorder can put you on the spectrum for an autoimmune disease and vice versa, which is crazy. All right. All right, so MindBody Medicine is a whole concept of looking at really it's harnessing the connection between all these things, physiology, psychology, biography. My biggest gripe with medicine is that we only look at the physiology. We don't pay attention enough to this. We definitely don't pay attention to that, right? We need to integrate all these things. And it's actually really important for women, your clients, who have the goal of losing weight as well. So one of the best questions you could ask is, what is your story? How did you come to be this way? And so this is a model that I have in the book as well that is a really good tool, because I like to have clients map this out and be like, okay, well, what's your idea of, let me ask you this, like, what do you think the major significant events are in your life that you don't forget? You don't forget that stuff. And so these are just random examples, but it's like, did your parents divorce? Did you lose your job? Were you sexually abused? Were you abandoned, right? And you kind of map this out and think about what year that happened. And then if you can try to help them also figure out what emotions you may have been feeling then. And again, you don't always know, and they won't always know either, but you can help them in different ways access that. And then you can see, like, okay, well, when did your symptoms start appearing? So we want to make this connection between when did we first have a major event in our life, and then when did the symptom develop? So a lot of times it's right after it. I see it all the time, right? I lost my job, right? And all of a sudden I started having crazy gut issues.
5 minutes, Justin.
Yep.
I have some questions for you too.
So this is a really good quote, because we really want to know what sort of person has a disease versus like what's the label we give them, right? They got here for a reason. It didn't happen overnight. So maybe we should look retrospectively and think about everything that happened and how they got here. And this is just showing, again, when you have trauma, you have a story, you have emotions about it, you have thoughts and feelings, you have a belief that you've carried into adulthood, and you have sort of self-defeating, self-sabotage behaviors. real quick story, I have a client who had an ulcer at 3 years old, and she was afraid. She had anxiety and fear about certain foods that were going to cause this ulcer to be worse or become an issue again. So she kind of created this story about it and has anxiety and fear, like I said. And so what she ended up doing was that she developed anorexia. Not because of her body image, because she was had dissatisfaction issues, but because of the byproduct of reducing her food intake and avoiding these bad foods that were going to maybe cause an ulcer. And so that honestly is how she ended up developing Hashimoto's. Part of it, not the only thing. But it's important, again, to understand that these three things that kind of happen here can really point you in this direction. So my whole thing here is we know a lot of what can get us into autoimmunity, but we should also think about self-healing, and that comes from within an inner wisdom, which is a lot of mindfulness stuff, which I won't get into obviously today, but we can take drugs and diet and supplements and all this stuff, but they are honestly, for a lot of people, not everybody, surface level interventions. If they've just been diagnosed, yeah, you can get by with that, and you'll probably get them in remission. But for people who've been sick for a long time and you don't really realize it, and you find out they have antibodies and they've been struggling for a long time, then yeah, there's more that's going to be, much more is going to be needed, essentially. And this is a great quote I like, because it's there are two types of suffering. The suffering that leads to more suffering, right, by avoiding our wounds and traumas, or the suffering that leads to the end of suffering by actually facing it and dealing with some temporary discomfort, because we know that there's light at the end of the tunnel and we can eventually heal and move on. Whether or not your clients want to do that is completely up to them. It's not anything you can kind of force them to do. This is just showing that there are some issues with both sides of alternative and allopathic medicine. And so reiterating the fact that my experience, most cannot diet and supplement their way out of an autoimmune disease, because it's just been they've done it over and over again with multiple doctors and they don't get very far. So your job, hopefully, if you can work with these people, is to help them do more than that and really tap into psychology and the trauma stuff. If you do lab testing and you're capable of doing it, okay, well, my thing here is that a lot of, no offense to naturopaths out there, they like to run 7, 8, 9 at a time and give them 20 supplements for every little deficiency they have.
What are you trying to say?
I know. And my point is that that's really costly and it gets really stressful. Now okay, I got to take the supplement. What time do I have to do it? And what's the dosage? And do you think that really is? You think it's counterproductive to their autoimmune disease? Yeah, absolutely, and that's the issue. So how about you do one thing at a time? Less is more, the domino effect. And I find this happens so many times where you do one test, you do one sort of thing, you work on the gut, you work on the drainage and liver stuff, and then you give it some time, and then they start feeling a lot better, right? Versus doing everything at once, and they're overwhelmed and don't know what to do, and it just compounds the problem. So these are some of the labs, again, you can consider to use if you can do it. Walk-in lab, Ulta labs, direct labs, that's stuff that you can do online yourself. And honestly, if you're having issues with doctors and they won't run these labs, which happens a lot, you can do it. You pay out of pocket, but at least you get the answers you're looking for if you want to do it. Organic acid is a huge one I use a lot, because a lot of the fungus and candida issues show up a lot with our clients. And so there's a lot of debate about the accuracy of it, but I truly believe in it, and I know the company pretty well at Great Plains. So I'll use that a lot, and the GI map is, again, the one that I would say that you can really dig into the infection stuff that we spoke about before, if you really want to go that far. I don't use a lot of these labs, honestly. I mean, I use them every now and then, but it's just, again, stuff to consider, okay? The Dutch test is great. Not everybody needs to do it. The leaky gut test, you can pretty much assume everybody with an autoimmune disease has leaky gut. And the food sensitivity test is just not accurate as a whole, really, it's not. So I'm not a fan of using those. And then these are just other considerations if you feel like your clients should probably explore this and work with their doctor on that, which is just, checking for mold, the mycotox, SIBO with hydrogen methane, breath tests, Lyme panel, co-infections. I use MDL lab for that, and heavy metals if you want to do that. That's walk-in lab. So this is pretty much the end of it. This is my kind of my entire list of things to work on and think about with clients with autoimmune disease. So all this is obviously going to be specific to the person, but the point is that you don't need to do all this at once. In fact, I don't encourage it. I say, how about you work on the gut? How about you work on the diet? stress, trauma stuff maybe, and see how far you can get with that, right? You can get into all the gut infections and toxins testing and drainage stuff if nothing else is working, but you gotta take it slow. You really should, because it'll be less of an issue for your client, but you won't drive yourself crazy either in trying to give them all these things to do. So take-home points are: consider undiagnosed autoimmunity and weight loss non-responders, okay? Assist in the healing process, but be mindful of your limitations, and you're gonna have limitations. Sometimes you can't do everything, and I don't expect you to, and I can't either. That's why I ask people like Dr. Eva and other doctors who can help with this, because you may need ozone, they may need low dose naltrexone, and so you can't obviously do that without a doctor. And just be aware of the fact that your clients may have unreconciled, unprocessed emotions and pains that may be why they're still having issues with self-sabotage, binge eating, and all these issues that, just be just be a mindful eater, that's it. But really, that's not going to work if they have abuse and trauma and all this stuff that's underlying it. A lot of times, in my experience.
Hey, Justin?
Yeah.
Quick question. So, is the trauma or stress is it modulated by the vagus nerve? Is the question. How does that work for you?
Yeah. So again, it comes back to the HPA sort of issue where you're putting out a lot of cortisol, right? So it's definitely, it's going to affect your vagus nerve and it's going to impact the gut, but it's also, there's many different sort of pathways. So you're going to have cortisol that's really high and it's going to cause leaky gut and damage there. And that's what happens when you have trauma. That's, again, it's not just one sort of trauma or experience. It's usually multiple times, but it's also whatever the interpretation of it was as a kid and what you've had, right? So the bottom line is that, that heightened stress response is going to be happening, and it's definitely related to vagus for sure. Yeah.
And there's a book here called Accessing the Healing Power of the Vagus Nerve. It's a great book that sort of talks about what he was sort of talking about, how that impacts and is related to adverse childhood events, and, and there's some techniques you can use.
Yeah. So this is just the final stuff here. If lifestyle can get you in autoimmune disease, lifestyle can get you out. Think about that, right? And again, one of the things I like to help clients do is look at their symptoms, right? The symptoms and the pain provides the source of where the healing is if we listen. Right? The path to happiness, sense of well-being, is not in avoiding suffering or pain, but using that as a vehicle to gain deep insight into one's life experience and the true nature of their health. So that is, again, another way of saying we can try to do all the diet and exercise stuff, but they're still having issues. Let's see what their biography is. How'd they get here? Okay, and if necessary, you might need to refer out. So that's it. I guess that's it,
Fantastic. So stay right there, Justin. So thank you, Justin.
Speaking so fast. Yeah.
Let me just stand close to me so they can hear me. Ask if they can hear me, Gary, on here. Can the live streamers hear me okay? Talking next to Justin?
Yeah, they can hear you.
They can hear me good? Okay, so a couple wonderful things about this. I want to kind of, put the whole thing in context, and then Justin and I will take some questions. And then we can even ask questions to, there's a lot of professionals here. We can kind of open it up here towards the end. But a couple questions I had for you right away. So if you were going to essentially say, what would be, the one or two things if we were going to talk about autoimmunity and the clients that they're going to work with, what are the one or two things that you would say, make sure you tell your clients this about autoimmunity? What would you say those big sort of rocks are for us?
Yeah, so it's that question of, does anybody in your family have an autoimmune disease? You want to ask that question, right? And so also, what sort of, again, looking at that timeline I showed you before and having them map out when symptoms started to appear. If it's all recent and acute, then that's one thing. But a lot of times they have, I've had fatigue for 11 years, brain fog for 13 years, and I've had thin hair for 8 years. And so that can point you in a direction. Maybe there's, there's an autoimmune component to this, or maybe there's undiagnosed autoimmunity. And then you can start to checking for antibodies. So if your mom had, MS, right? You can check for antibodies against the myelin and Hashimoto's, TPO antibodies. And you really want to do that because it's going to save them a lot of pain and heartache later. And then
based on those questions, if you're determining this is potentially going on with someone, of the
Yeah.
tools that we've learned, what are the big tools that you would pull out and say, based on that, here's what you want to have them do? Like, is it the big gut restoration stuff? Is it, moving to an EL type lifestyle? Like, what would be, once you see that the autoimmune stuff is probably there,
honestly,
what are the tools that we can use?
Right. Honestly, you can keep it really simple, and you probably will get really great results if they're in the early stages, in the stage 1. We're just working on the gut, the 4R stuff with removing antigenic triggers with food, healing the gut lining, demulcin, slippery elm, those sort of gut restorative things. Digestive enzymes, bile support, cholagogues, that stuff, bitters, right? Make sure if they have bile issues and stuff like that. So healing the gut and then reducing stress and helping them do that any way you can. It's a very complex thing because it's like, well, how do you just meditate? No, but it's part of it. Meditation will actually help and do a lot of things if you can get them to do it. But it's reducing stress, whether it's present stress or past trauma stuff, and digging into that. And so maybe that's a little beyond what you're able to do, but I just want to have you be aware of that.
That's the reason I want to ask Justin this question, because see, isn't it really interesting as we all sit up here and you see some very complex science from myself, from Sam, from Justin, and then we come back to very simple tools that are big hitters that we can use, which brings me to my third question with the adverse childhood events. Like, what is, because I have a tool I want to give you and I want to get everyone's take on this, that the one thing that I have used, because we want one thing, right? We're going to send people to people, send them to people like Justin if we really need them to work on this, but there are big hitters we can do. So what are the things, one thing, two things that you do when you find, okay, there's some adverse childhood events, there's a big trauma here that we want to address? What is the major, sort of tool that you pulled out, or where do you send them? Because you may not be doing that work, but maybe you send them somewhere. Just curious.
So not everybody, but some will do these sort of different things like QNRT, EMDR, tapping, EFT, all that stuff, which is great. But the thing that I do differently, and I learned this, is that we got to integrate their consciousness. It's the truth that liberates, not the effort to be free. And having that new awareness is actually self-liberating. It can be.
Say that again. Say that again, Alana.
It's the truth that liberates, not the effort to be free.
And so
having awareness, and a lot of people don't, and that's why if you draw this connection of like, that's why I'm in this, that's why I have codependency issues and I'm looking towards my husband, or that's why I had a divorce because I was looking towards him for approval, and all this stuff happens a lot. These sort of patterns I see, and you tie it back to, well, maybe it's because you didn't get attention at 5 years old when you were sick from your mom. Right? So what were you looking for? Attention, approval. Yeah. And it carries over. And that's, again, you want to draw these connections. And once people see that, not always, but sometimes they're like, wow, that's peace of mind. And I can start to release that because it's not serving me as an adult anymore. Right?
I knew he was going to answer the question like that and it's a perfect segue into, what he's essentially saying is the awareness of this first.
Yeah.
And kind of bringing this to sort of our awareness that makes the biggest difference. And I want to share a technique based off that I think is the best way to awareness and turn it. Because if you listen to what Justin said, did you notice he talked about the story? It's the stories that we tell about the trauma, not always the trauma itself. And so to a large degree, a lot of this stuff is post-traumatic stress chronically or manifesting years later. And there's one technique that I use in particular called story editing. Is anyone familiar with story editing? So essentially all this is when you essentially have something that happened, and essentially what Justin is saying is that the awareness is the first piece. So they have to kind of confront it. But once they confront it, we need to rewrite the story. I mean, let's face it, all of us humans are going to be faced with suffering and pain. The Buddhist philosophy is, which I love this philosophy, is that life is suffering, period. The thing that makes the suffering better is to decide what it means. We get to choose the meaning of that suffering. And the way we do that is to simply write a different story for it. For example, we've talked about this, Gary and I have talked about this. Not a lot of people remember this. Maybe I'll be showing my age here, but I was a child of the 80s, right? What do we consider us child of the 80s, right?
Yeah, Generation X.
Yeah, Generation X. So when we were kids growing up, you might remember this, Brad. When we were kids growing up, I remember sitting there having cereal and looking at these missing children on my milk carton. Those missing children being on that milk carton saved countless, thousands, hundreds of thousands of kids back then. You know how that came to be? I think it was a mother or a father, I can't remember which, essentially lost their child. Child got kidnapped and murdered. And how do you make meaning out of something like that? So what she did is she turned it into something meaningful by healing other people and helping them find their kids. So the story editing process essentially goes like this. You literally have your client take out the notebook like this and say, I want you to write what happened. I'll use myself as an example, right? So I had Jill, who you met. We went through a troubling time in our relationship, and essentially that thing that happened, I had to look at certain aspects of myself and come to an awareness and an honesty about myself, like what Justin's talking about. And essentially what I do is I write the story as it happened exactly. This happened, that happened, in chronological order, like I'm watching myself living a movie, right? This is the first part of this. And you have your client do this. And then you reach a point of current day, right? So you write the story exactly as it happened, as you understand, then you reach current day. And now, as if you're writing a movie, right? And you're the director and producer of this movie, you write the rest of the story. You give it plot. You give it meaning. You talk about the lessons that you learned from it. And most importantly, at the end here, you tell your hero story. How this traumatic event actually led to all this wonderful, meaningful, beneficial stuff that you will create for others in the future. And this immediately solves the problem for making meaning out of it. It doesn't immediately solve the pain. You will suffer. It doesn't even take the hurt away necessarily. But it starts to integrate this process. And so this is one tool that I use. So it's write the story and then write in detail how you overcame this. So my story goes, I was X, Y, Z. I was honest. I was a coward. I was different things. And as a result of that, I learned X, Y, and Z. And I became this person as a result. And taught conferences on how to be honest and how to be better and how to be stronger, etc. And then, of course, you reach that point where now you have to hold your client accountable and they have to do it themselves, right? It's not fake it until you make it, it's sort of be it until you see it. So they got to go out there in the world and start being this thing. And as they be this thing, now all of a sudden what they're doing is tying back, wow, I could not be this incredible thing without this horrible thing. And now the horrible thing is not so horrible anymore. And that's one way to do it.
Yeah. My book goes into more, the second half of the book goes a lot into this, about being before becoming and learning how to be with the pain and before you become this. And that's a lot of like what he's saying about meaning, message, opportunity with your traumas and wounds. Yeah.
So I think that's just a great sort of place to start, because as we go from physiology, stress reactivity, all these protocols and this and that, then Justin comes up and essentially says, hey, look, by the way, we're missing this whole other aspect that everyone ignores, and it's directly connected to all the physiology that we're talking about, and at least we have one tool to sort of deal with that and others. Does that make sense, and is that helpful? So any questions for Justin, or even me?
This is actually for Justin. There's a great talk about the mental emotional bit. Going back to the autoimmunity aspect, since you do a lot of work with that. So do your patients, how about if their labs never change? And because I know there's this slide that you had about antibodies and then a predictive value. And it predicts in 10 years you might be symptomatic. How about, because it's kind of scary to know that, this might happen to me in 10 years. You're like, I'm doing everything. Labs never change. They're not symptomatic. So you just say, I think it'll be fine. We're doing everything we can.
No, I mean, it's if you have evidence of antibodies, then it's not going to be in the thousands most people are in stage 3 for Hashimoto's, for example. But if it's 100, 200, 300, like, okay, well, you're on the spectrum, so and they have no symptoms, that's a good thing, but you want to be like, again, work on the gut stuff and see about antigenic triggers that, from the research, that could set it off. And start with that, right? Maybe check into infections, because you want to put it in its tracks now before it gets worse. So the antibodies will get eventually higher and higher if you do nothing. And that's my point, you know?
I think, I know Hashimoto's may get worse, but even like scleroderma or lupus, like it's just, like they just say, oh, positive. Like it's not like they give you necessarily a number.
Yeah.
So then, if that number is always there, and patients who are asymptomatic to begin with, you're just like, I'm just going to try to nip it in the butt. But then we have this research saying that, well, it predicts that maybe in a decade you might get this.
If you do nothing, that's my point, is that if we do nothing about it, be like, okay, we don't even know, too, then yeah, you're definitely going to get the disease some odd years later.
And
Does that make sense?
And to that same regard too, as you know, in terms of treating these things, just like we do intermittent dieting, right? In my mind, we should be doing intermittent treating as well. So it's not like you just go, okay, for the rest of your life, you're treating this thing with these protocols.
Yeah.
It's almost like we're going to do some hardcore treatment, like gut restoration stuff or something like that. Then we're going to give them a little bit of a break, and then maybe we come back to it as well. So I think we all sort of do that stuff.
Mm-hmm.
Any other questions or anything like that? Okay. So, any other final questions about the event in general, or anything you want to talk
What
about?
about PTSD stuff with people who can't remember trauma?
Mm-hmm.
So how do they go back and heal that trauma if they don't remember?
Yeah.
trauma?
So the question is, what about PTSD stuff with people who can't remember trauma, so they never get the awareness of this? So here's another way. You know, Jill talked about exposure therapy. So another thing we do in sort of coaching and counseling, and I have a little bit of a counseling background as well, is we do exposure therapy to things that people are afraid of. I call it a fear PR, right? So the idea is, for example, and we'll use arachnophobia because there's a really cool study on arachnophobia, fear of spiders, right? In this case, it's basically what we are doing is you're saying, oh, you're afraid of spiders? Let's let you watch a movie with spiders in it. Then, and they do this within a 3-hour time period, then they go, well, let's now bring you in and have a tarantula in an aquarium for you to see it there and kind of watch it. And then they'll like have it out where it's about and someone else is handling it. Then maybe they'll have you touch it with a straw. This is actually a study, right? So you actually touch, and within a 3-hour period, many of these people actually voluntarily allow this spider to get on them. So this is a known fear, but for people who are fear and don't really know they're having some of these traumatic events, one of the things that happens when these things come up is and jump in here, Justin, too, if you want after this, but what we tend to do, all of us humans, is we tend to go, and Justin talked about shame and other things, we tend to go, I'm weak, I can't handle this, and we push it aside. And part of what we want to do is we want to go to other places where we're strong, and we can give our brains the ability to see us being strong in certain places. This is where the gym can be really helpful, right? Where you go in and start getting these people involved with weight training and seeing themselves lift heavier and heavier weights, they see themselves as more resilient. Or you start saying, we're going to start exposing you to being alone if you're afraid of being alone. Or in crowds if you're afraid of that. Or doing more events like this if you tend to be an introvert. And we start to coach them. We don't even know what the trauma is or what the suffering is. We just know they're there, but we start giving them evidence. Because remember, your brain is watching you all the time and judging you. Matter of fact, it judges you pretty damn harshly. It judges you a lot more than you're judging other people. And it will go, Jade, you're full of shit, man. I mean, you say you want to do this, but you're not really going to do it. We need to give our clients the ability to have wins in other areas. And then those wins will hopefully roll over. And eventually, they're feeling resilient, strong. They start seeing themselves as strong overall, and I can handle anything that comes at me. So then when they get re-exposed to their father who maybe abused them or was an ass, or an old lover that triggers them or whatever, all of a sudden, they are like, wow, I'm not triggered as much anymore because I feel self-efficacy in life in general because I've been working on this. And so one of the things we do is we don't get bogged down in the thing, right? Or trying to go, sometimes the process actually can make it worse. We just go, the issue is you're afraid and you're suffering and you're hurt and you feel at the whims of life, like you have no control. And so we start teaching you, and this is just a form of cognitive behavioral therapy. reams and reams and reams of research on this. But we can do it in realms that are unrelated to get the brain to begin seeing yourself as strong. Does that make sense? So this is the way to begin to get some of this stuff on board, because it's tricky for us in this realm, for all of us coaches, right? But with a few things like this, like understanding exposure therapy and understanding story editing, you actually can do a lot for people that even their therapists might not be able to do. Does that make sense? You have anything to add to that?
Not really.
So I've recently started to look at prolactin a lot, and you mentioned that earlier in regards to breastfeeding women. So in the presence of a non-breastfeeding woman and any sort of prolactinoma, and you see elevations of prolactin, how do you treat that, or have you treated that before?
Yeah. This is an area where I'm out of my league, right? So I want to see how you deal with that. So the question for you live streamers is talking about, actually I had a male with a prolactinoma once, and I tried to use curcumin because I looked at research to try to address this, because curcumin has some indications that it will push down prolactin, but in the end we weren't able to do anything because that prolactinoma just continues to secrete sort of prolactin, and that interrupts with testosterone and does a lot of other things. But that's my only sort of end in working with that particular hormone. The other thing I know about prolactin is it is the hormone of orgasm, especially for men. Men secrete like 5 times more prolactin than women, and they think that in regard to orgasm, that's why men will tend to go to sleep and have this refractory period, because it's a relaxing sort of hormone as well. But that's about as far as I get with prolactin. So I would love to hear your take on that, or anyone else.
I don't know. I've heard Vitex potentially treats that, but I haven't heard any doses for it.
It brings up such a great point though. Vitex, yeah. It brings up such a great point when we're talking about some of these things, like for those on the live stream and everyone here, when we talk about things that sort of like, this is where we go, I don't really know, there's certain things I know really well, certain things I don't. Like, I don't know a lot of the autoimmunity stuff the way Justin does. So for me, part of the reason I wanted to have him come, because I thought you don't do a female event really without talking about autoimmune disease, because it's such a big deal. And I also wanted to learn, because I wanted to learn the science stuff, right? But you just basically go, hey, I don't know much about this, and so I am going to refer out to an expert. And normally when we say expert, your physicians, your general family doctors aren't going to know the hormonal stuff, right? So you're going to want to deal with an endocrinologist, or hopefully a functional endocrinologist, which I consider myself, but if you don't deal with the condition a lot, like Alice is saying too, then I don't have a whole lot to say about it other than some of the things I've read on prolactin. So, does that make sense though? Because that's a discussion more about staying in our lanes and sort of understanding what we know and what we don't know. And it actually illustrates something interesting for all of you, right? Because I am up here teaching, Justin's up here teaching, several people are up here teaching, but that doesn't mean we know everything, right? There's actually, everyone in this room, Ann could get up here and teach, Alice could get up here and teach, some of you, Brad could get up here and teach their stuff. And we have to, I think, one of the things for all of us practitioners is learn who's an expert in what. Learn the stuff yourself, but more importantly, learn who is the expert in what, and become friends with them even. So I can call Justin and be like, hey man, so I've got this autoimmune stuff. I'm not that up on it. Can you help me with that, right? I can reach out. And so that's another thing about just having a network, which is another great thing about these events. And which is why, like Gary and I always talk about, we need to do more of these live events, because it's the only place where you get in the room and you actually make these connections that you can go away and reach out to people and be like, you mind if I hit you up with this question I have? Because we can't know everything. We have to sort of make sure we're, bouncing ideas off each other. So I like that, sort of question, because it speaks to that. Any other things that, any of you want to just address briefly before we shut down and end the event? Okay, so for you live streamers, thanks so much for being here. Just so you know, live streamers, we will get you're going to get all the recordings, and everyone in this room will get the recordings, and we will put them in a portal with the notes and the full lecture, so you can come back to them again and again, okay? So that's all we have. So thanks so much for everyone being here. Really appreciate it. Thank you so much for the live streamers as well. and we'll see you at the next event. So thanks so much. Thank you, Justin.